Dogs are incredibly skilled at hiding pain and discomfort. It's part of their survival instinct, a trait passed down from their ancestors who needed to mask weakness in the wild. Unfortunately, this ability to conceal suffering makes it dangerously easy for even the most attentive pet parents to miss the early warning signs. And by the time those signs become obvious, the problem might already be severe or even life-threatening. In this video, we'll uncover 9 subtle but crucial behaviors that could be your dog's way of begging for help. These signs are easy to miss, but once you know how to recognize them, you'll be better equipped to protect your pup from both physical pain and emotional distress. Spotting these red flags early could make all the difference in getting your dog the care they truly need. Section 1. Excessive paw licking or scratching. Paw licking is one of the most commonly overlooked behaviors in dogs. While occasional licking or scratching can be completely normal, like grooming or a response to temporary irritation, obsessive or repeated paw licking is often a major red flag. This behavior can be a sign of several underlying problems, ranging from skin infections and seasonal allergies to mites, fungal conditions, or even compulsive behavior stemming from stress or anxiety. Environmental triggers like grass pollen or household cleaning products can cause irritation, especially in sensitive dogs. And in warmer climates, fleas and ticks are notorious culprits that often go undetected by the human eye to distinguish between harmless itchiness and something more serious. Look for signs like hair, thinning on the paws, red or inflamed skin, mouth patches, or bleeding. If your dog is licking or chewing at their paws even while resting, that's a strong signal they're experiencing discomfort, not boredom. Many owners reach for home remedies like paw balms or anti-itch sprays without understanding the root cause. But before applying anything topical, it's essential to consult a veterinarian. A proper diagnosis can help you rule out parasites, infections, or allergies and begin targeted treatment before the issue worsens. Section 2. Sudden limping or gait changes. When a dog suddenly starts limping or walking differently, it should never be dismissed as just a sprain, or they probably stepped on something. Limping can indicate far more than a surface-level issue. It could be a sign of internal injury, ligament strain, or even a bone fracture. What makes this behavior tricky is that dogs are exceptionally good at masking pain while they move. It's not uncommon for a dog to run or play with bursts of energy only to favor one leg shortly after. They may avoid putting weight on a certain paw or shift their weight when standing. These subtle changes are easy to miss but incredibly important to notice. A helpful step is to gently examine their paws for cuts, swelling foreign objects like thorns or signs of bruising. But if there's no obvious surface injury, joint manipulation like bending the leg or touching the hip may reveal signs of tenderness or pain. Avoid pushing too hard, as this could worsen a potential injury. More alarming red flags include your dog suddenly refusing to jump on the couch or into the car, avoiding stairs, or yelping when trying to stand. These behaviors warrant immediate attention. A vet examination, possibly including X-rays or physical assessments, can help determine whether the issue is orthopedic, muscular, or neurological. And most importantly, prevent long-term damage by treating it early. Section 3. Destructive behavior as emotional expression. When a dog tears up pillows, chews furniture, or rips apart shoes, it's easy to label them as naughty or bad. But what if that destruction is actually a cry for help? Destructive behavior is often rooted in emotional distress. Dogs may act out when they feel lonely, anxious, understimulated, or even physically uncomfortable. For many, especially those left alone for long periods or recently experiencing a change in routine, chewing or tearing becomes a self-soothing coping mechanism. This type of behavior is commonly seen in dogs suffering from separation anxiety. They don't destroy objects out of malice. They do it to release nervous energy or express panic. Other times, boredom is the driver. A lack of mental stimulation or physical activity can lead dogs to create their own entertainment, even if it means chewing up your favorite chair. More surprisingly destructive behavior can also mask physical discomfort. For example, joint pain or chronic stress may make it hard for a dog to settle or rest peacefully, leading them to pace, dig, or gnaw to distract themselves. The solution isn't punishment, it's understanding. Introducing puzzle toys, setting a predictable routine, and increasing both physical and mental enrichment can reduce anxiety-based destruction. For dogs with deeper emotional or physical struggles, professional training or veterinary support may be needed. Section 4. Persistent coughing or breathing difficulty. A cough may seem like nothing more than a temporary irritation, but in dogs, it can be an urgent warning. Chronic coughing, especially when it seems to come from nowhere or persists over multiple days, can point to several serious conditions, including bronchitis, pneumonia, heart disease, or even growths in the airway. The danger increases when coughing occurs during rest, or when it's accompanied by labored breathing, wheezing, or odd noises like honking or snorting. Dogs may also show signs of fatigue after only mild activity, or make a huffing sound while trying to settle down. Certain breeds, particularly brachycephalic ones like bulldogs, Frenchies, and pugs, are at a higher risk for respiratory complications. Their compressed airways can make it difficult to breathe even under normal conditions, and added strain from infections or inflammation can quickly become life-threatening. If coughing is paired with symptoms like lethargy, appetite loss, or blue-tinged gums, it's an emergency. And even if it seems mild at first, a persistent cough lasting longer than 2 days, especially if it gets worse, should never be ignored. A veterinary visit is essential to rule out major cardiac or pulmonary concerns and to begin appropriate treatment, which could involve medication, oxygen support, or further diagnostics. Section 5. Changes in appetite or hydration habits. Dogs are creatures of routine, especially when it comes to food and water. So any sudden change in how much or how little they eat or drink should immediately raise concern. A dog that suddenly refuses food or water may be experiencing oral pain, such as dental disease, a cracked tooth gum, inflammation, or even throat irritation. These issues can make even their favorite treats unbearable. But it's not just refusal that should catch your attention. A dog that begins drinking excessively could be showing early signs of more serious systemic conditions like diabetes, kidney disease, or Cushing's disease, each of which impacts how their body processes fluids. On the flip side, decreased water intake can also indicate nausea, fever, or even dehydration caused by an underlying illness. Another key warning sign is unexplained weight loss. If your dog is eating normally but still shedding pounds, this could point to intestinal parasites, digestive disorders, or something more serious like cancer or thyroid imbalance. Watch closely for symptoms like vomiting after meals, excessive drooling, bloating, or unusual gas. These often indicate digestive distress or toxic ingestion. It's vital to observe patterns and act early. Don't chalk it up to a weird day if it continues. Your dog's relationship with food and water is one of the clearest windows into their internal health. Section 6. Stiff movements or slow mobility. While it's common to associate stiff movements with aging, stiffness can affect dogs of any age and is not something to overlook. Dogs may develop mobility issues from early onset joint disorders, hip dysplasia, spinal misalignments, or infections, such as Lyme disease, all of which can cause inflammation and pain. The signs can be subtle at first. A dog who hesitates to jump on the couch, struggles to get up after a nap, or doesn't want to play like they used to. These aren't just signs of slowing down, they're indicators of discomfort. You might notice a change in posture, shorter steps, or a reluctance to climb stairs. To support joint health, low-impact activities, like short, controlled walks or swimming, can help maintain flexibility without overstraining joints. Orthopedic dog beds can also relieve pressure and provide better sleep quality. Joint supplements with ingredients like glucosamine and chondroitin may offer mild relief, but when stiffness persists or worsens, veterinary treatment becomes essential. Always pay attention to subtle physical changes. What seems like minor hesitation today could turn into chronic pain tomorrow if not addressed early. Section 7. Social withdrawal. Hiding or unusual aggression. Normally social and affectionate dog that suddenly begins hiding or becoming reactive, especially around guests, is often trying to communicate discomfort. This behavior isn't always rooted in fear or training problems. In many cases, dogs isolate themselves when they're in pain or feeling unwell. It's a natural instinct in the wild. Animals hide when they're vulnerable to avoid further threats. Growling, often mistaken for misbehavior, may actually be a polite warning. "I'm not feeling well. Please don't touch me." It's important to listen. Alongside these behavioral changes, you might also notice other physical symptoms: fever, rapid panting, or increased thirst. Some dogs even change where they choose to rest, moving to cooler spots or quieter corners. More alarming still is when a previously calm dog begins to display aggression. This could indicate pain stemming from neurological issues, tumors, or hormonal imbalances. If the behavior appears out of character, a medical evaluation is always better than discipline. Pain often hides behind the behavior. Section 8. Whimpering, whining, or trembling without obvious cause. Dogs use sound and body language to communicate, and when they start whining, whimpering, or trembling, for no clear reason, it's often a sign something is wrong. Vocalizations can be breed-dependent. Some dogs, like huskies or shepherds, are naturally more vocal, while others may suffer in silence until the issue becomes unbearable. Trembling in particular is an ambiguous but important symptom. It can indicate cold sensitivity, physical pain, panic attacks, or medical conditions like inner ear infections, digestive upset, or even poisoning. Don't assume it's anxiety without ruling out other possibilities. To identify hidden sources of pain, gently examine your dog's body. Swelling in the ear canal, inflammation in the gums, constipation, or even irritation around the tail or genitals can all cause discomfort that leads to whining or trembling. The most critical tool an owner can develop is familiarity with their dog's normal behavior. By knowing how your dog typically sounds, moves, and reacts, you'll be quicker to spot when something's not right and take action before it worsens. Section 9. Sudden changes in barking frequency or intensity. Barking is a dog's natural way of speaking, but when the volume, frequency, or tone of barking suddenly changes, it often points to emotional or physical distress. A dog that starts barking excessively when left alone might be experiencing separation anxiety or loneliness, especially if the behavior is new or occurs after a change in your schedule. On the other hand, barking when touched or handled could signal that the dog is in pain, especially if they yelp when specific body parts are touched. Dogs may bark more when something doesn't feel right, whether that's discomfort in a limb, tension in the spine, or internal aches. Pay close attention to the emotional context. Has there been a recent move? A new baby or pet introduced? A change in your routine? Environmental stress often triggers behavioral shifts, and barking is one of the loudest ways your dog can ask for help. Occasional barking is perfectly normal, but a sudden or sharp change deserves your attention, not just a quiet command. Dogs can't explain their pain in words, but their behavior speaks volumes. Whether it's a limp, a whimper, a shift in sleep pattern, or a sudden loss of appetite, these signs are their only way of asking for help. As pet guardians, it's our job to listen, not just with our ears, but with observation, empathy, and responsiveness. Recognizing these subtle cues early could prevent a minor issue from becoming a lifelong condition, or worse, a medical emergency. Always trust your instincts. If something feels off, even if you can't explain it, don't wait. Contact your vet, ask questions, and advocate for your dog. They're counting on you. And if you found this video helpful, consider sharing it with others. You never know whose dog might be quietly crying out for help, just waiting for someone to notice.